Hi, I'm Rick Strang. I'm the lead for emergency care in the Trust at the moment. We've been struggling down in the emergency department to collect feedback from our patients to tell us how we're doing. We're really keen to get that feedback, but at the moment on the Friends and Family test, we're getting about 45 responses a month. And just to give that some context, we see about 6,500 adults. So just get 45 bits of feedback back doesn't really give us a picture of what's going on. So our challenge was, how could we get our staff to give out the forms and encourage patients to give feedback to us? One of the things that we've done is that we've discovered that all of our staff carry a little stamper which they use in the medical notes. Whenever they write something in the notes, they stamp their name on it to say that they've done it. And what we've asked staff to do is take a collection of the Friends and Family forms and stamp their name on them. And then when they hand those forms out to the patient, at the end of the month when all the forms come back, we count up which member of staff has given out the most forms, and that member of staff will get a prize. And the prize in the first month was an iPod. And just to give an example of how much that's driven the change, we were, as I say, averaging about 45 responses a month. But in October, when we started this, we got over 800 responses back, 869 in fact. So it's driven a real change in what's happening. The other more subtle thing about this, though, is that if I'm the nurse that's giving you a slip of paper to ask you how our department's doing today, and my name's on that slip of paper, I probably want the department to be doing pretty well before I do that. So there's a sense now, there's a bit of ownership about the feedback that we're asking. So we're not asking a remote thing about how do you think we're doing. We've got that real individual attachment about how am I doing, how is our department doing, because my name's on that bit of paper that I'm giving to you. And we're hoping that that will develop things more as we go forward.